5 to 6 days old baby should have at least 6 to 8 wet diapers if the baby is feeding enough.
Got it.
Right? That's what the pediatrician says. That's what everybody, WHO say. Breastfeeding never hurts.
Okay.
Right? And it should be smooth. So if it is hurting, the latch is not proper.
Got that.
So if you don't want your baby to be a fussy eater later on,
Right.
so you should eat whatever you want him or her to eat later.
Okay.
Right now, because you are giving that taste and texture to that baby.
Sure. Hi new parents. Welcome to the very first episode of Tebinadi podcast, where science meets care and new parents find their calm. If you are expecting, if you have delivered, or you are navigating this wild but beautiful journey of raising a newborn, this is the right place for you. At Tebinadi, we are creating an ecosystem of education, thoughtfully designed products, and services in the midwife clinical services to back you in this particular journey, to support you well in this journey. In today's episode, we are diving into this beautiful but emotionally and physically draining world of motherhood, and the topic for today is feeding your baby. We are joined by an expert in this sector, Dr. Victoria Kumar, who is a leading lactation consultant and carries 15 years of work ex. She is a certified infant feeding specialist from WHO. She also runs a community. It's a WhatsApp community called Nurturing Your Baby, which has 500 plus parents. Today, she'll help us break the myths and guide new parents through this overwhelming journey. So let's welcome Dr. Victoria. Very common things that new parents ask us. So we would have done 60-70 interviews. The major question on their mind is that, is my child feeding enough? Am I underfeeding the child? Am I overfeeding the child? Is my child feeding enough is the question that most of them have.
Okay.
What's your perspective?
Right. So if we take as a new mother or a father, parents, right? So definitely everybody has got this question in the mind, right? My baby is feeding enough or not? So the definitive answer for this is like you have to just only keep on checking the wet diapers, right? So a 5 to 6 days old baby should have at least 6 to 8 wet diapers if the baby is feeding enough.
Got it.
Right. That's what the pediatrician says. That's what everybody, WHO say. Right. This is what should be looking for.
Sure.
Right. Then, mother and father, the parents go into a vicious cycling, like weighing the baby, and then checking the poos and all that.
Yeah.
So which is not correct. Right. Mm-hmm. So if a baby is on mother's milk, so pooing will not be there. Right. So because breast milk is so light that it is absorbed by the body.
Got it.
So sometimes baby on breast milk, they don't poo.
Got it.
And the mother thinks that my baby is constipated.
Okay.
Right. So it's not correct.
Yeah.
And then what some parents, what they do, they before every feed they'll weigh the baby, and after every feed they'll weigh the baby. Right, so just to see, how much the baby has got the milk.
And it's just overcomplicated.
Yes, it's just, you are getting into that cycle which is never ending.
That's right.
It's never ending. Yeah. So it's with us also. Sometimes the baby will take whatever the baby wants to, and sometimes the baby will not take because of the baby is not hungry.
Yeah.
Right. So it is like that. We also do the same thing. Right. Sometimes we have hunger for 2 rotis, and sometimes we have hunger for 3 or 4, rotis. So it is like that. And the same is with the baby. So don't get into that vicious cycle.
Got it.
Just see how much diapers you are getting. That's enough.
Got that. This is very helpful.
Yes, that's very important.
Sure. So once a new parent sees that the baby is being fed well by counting the number of wet diapers that they have, the second major thing which is a common problem across most of the parents is that the baby sleeps while having the mother feed. How do you solve for it? Do you wake the baby up? Or do you forcibly have the baby take that feed? How do you solve that issue?
Right. So the answer to this question is, like, there are periods of growth, right? And the babies are categorized in that. So first is when they are born, they are in the neonate period. Newborn period, not
Sure.
neonate, newborn period.
Sure.
And that is for first 7 days.
Got it.
And then after 7 days is their neonate period. Okay, till 28 days.
Got it.
Right. So in that phase, so take it as a 1 month time.
Right.
So what we say, when the baby is onto the breast, when the baby is feeding, the baby should be tickled. The baby should be tickled.
All right.
Right. The baby should be tickled so that the baby continues feeding.
Sure.
Okay. And of course they will fall off on sleep, right?
Yes.
on the breast, because they get the warmth.
That's
they
right.
get that comfort.
Yes.
And whenever you are comfortable, you relax.
Sure.
And you go into sleep.
That's right.
So when the baby is there, what you need to do is just give them tickles onto the body everywhere, right? So the baby starts suckling. It's not the baby will open the eyes and say, oh, I am awake, I'm present. No.
Yeah.
Baby starts suckling, that is more than enough. So that is what a mother should be looking.
Sure.
And of course the mother has to give tickles.
Got
so
that.
the baby continues feeding, because they will definitely fall off to sleep,
That's right.
right? Because they get the warmth and comfort.
Yes. And the baby usually craves for that warmth of the womb.
Exactly.
And that kind of atmosphere we create while the baby is suckling.
Yes, when the baby is with the mother,
Yes.
that smell comes,
Yes.
that this heartbeat sound,
That's
and
right.
everything makes them so comfortable that they go off to sleep. And once the neonate and the newborn period is over, the baby are pro now, right? So it is like they'll feed, they'll sleep, they'll feed, they sleep.
Yeah.
Mostly like that.
Yes.
But if they don't do that, yes, the mother has to tickle them and go on.
Sure.
Right? So
it's
that is
a
how.
fairly easy solution for a very, very common problem that most of the parents have.
Exactly.
Got it.
So that is what. First, you have to be comfortable. The mother has to be comfortable, because if the mother is not holding the baby comfortably and all that, going here and there,
Right.
everywhere.
Right.
So that will not, be a solution. You
Yes.
have to be comfortable.
Got that. Many a time we are also asked, how long should a typical breastfeeding session be? What's that typical duration in which we also feel comfortable that the baby had enough of the feed,
Right.
and we are not overfeeding or underfeeding the baby? What should that typical duration be?
Right. So the duration, generally depends on how much hungry the baby is, right? But the research shows that it takes approximately 12 to 67 minutes of the feeding time. So that is the long, the range the baby should be feeding on.
Sure.
So if we take it as 12 minutes, it means that the baby should actively suckling. The jaw should be moving.
Got it.
Right. But it can't be possible, right? The baby get tired, the jaw is tired, and they pause. So we say, and sometimes the baby are so active, they are so fast suckers, they'll suck it out, right? So it is like that also.
Sure.
So, but what we say to the mom as a common rule is, like, whenever the baby is onto the breast, the baby should be suckling most of the time. It's not like the mother has held the baby onto the breast for 1 hour and the baby suckled only for 5-10 minutes.
All right.
You're understanding? So baby just kept the breast in the mouth and slept off.
Sure.
So sleeping and keeping the breast in the mouth, they are not taking anything out.
That's right.
Right? So whenever the baby is onto the breast, they should be suckling more often.
And mothers should be aware of this, that babies are suckling. To what extent they are doing that? What's the duration of that?
Yes. And when they are suckling, so there are 2 kinds of suckling we usually encounter with. It is NNS and NS.
Okay.
So NNS is non-nutritive suckling, right? Which says that, which by its name it says that it's non-nutritive. It's just for comfort.
Sure.
Right? And NS is nutritive suckling,
Got.
in which they are taking out the nutrition, the milk out of the mother.
Sure.
Right? So they should be focusing on NS, which are deeper suckle. So NS is like NNS, that is.
Yeah.
And NS is like,
Okay.
right? So the jaw movement is quite
hard in NS.
and deeper
Got
in
that.
NS.
Got that.
So the mother should focus on that also.
Sure.
Right?
Sure.
It's just not only nibbling, they're taking the milk out.
Got that. And usually do mothers get this sort of training that they can differentiate between a NNS, NNS?
Oh, very good. So, means if I talk to a parent, new parent, I definitely educate them about this.
Yes.
But I don't know about how many people are giving this knowledge and this understanding to the parents.
Right.
But yes, definitely when the people will come across this video and they'll see, they will have the insight what is NNS and what is NS, and they should be looking for NS more.
Got that.
Yeah.
Got that. And of course, and when the baby sleeps while taking the feed, one should tickle the baby also.
Of course. There you go. Yeah.
And a concept that usually we also got to know after talking to a lot of new mothers was the concept of cluster feeding. Can you give your perspectives and to the audience that what is cluster feeding, why is it required, what are the benefits of it?
Right. So cluster feeding usually happens during their growth spurt. Usually, most of the mothers, they encounter cluster feeding when the baby is having a growth spurt, right? And they usually do that to comfort themselves, to take out the nutrition from the mother, so for their growth, right? So it definitely says the growth spurt, right? And it is normal. It's just a phase which will get over. So it's not like the baby has started cluster feeding, they'll go on for cluster feeding. It's not like that. It's just a phase. Maybe a week or 15 days, the growth spurt lasts, right? And that is how the mother should be looking in for. So don't get overwhelmed, right? My baby was, feeding well 3 days back, and now, the baby wants the milk every minute. The mother will feel like that.
Yeah.
So yes, definitely there's a growth spurt happening. So it starts and then it ends also.
Sure.
So it's not going to be forever like that. Okay, and it's normal.
And for the growth spurts to happen, are there any cues or symptoms that we should look at that when the baby is having a specific growth spurt?
See, every individual is different, right? Every baby is different. So as per my experience, where I have seen in 15 years, some babies, means we categorize, right? To 3 to 5 weeks old baby will have a growth spurt, and then 7 to 8, means it's like that. It comes and go, it comes and go, it comes and go. Definitely, when the growth spurt starts, you'll see the baby this much, and the growth spurt ends, you'll see a little bigger baby. So that is how you can differentiate now that growth spurt had ended. The cluster feeding has come down.
Sure.
Right?
And cluster feeding is a phenomena that the frequency of feed increases.
Yes, just the frequency of feed increases.
Doesn't matter how much the volume is, how much the baby is suckling.
No. So the mother will definitely feel like, means out of 24 hours, he's on the breast or she's on the breast for 24 hours. Right? It would be like that.
Sure.
Maybe 22 hours.
Sure.
Usne mujhe choda hi nahi hai.
Right.
It's like that.
Right.
Some mothers will say that.
Yes.
So it is a phase which will get over. Don't get overwhelmed. That's what I want to say to the mothers and new parents.
Sure. So new mothers, especially the first time mothers, usually have a complaint that the breastfeeding sometimes hurts. What could be the possible causes of that particular hurt, and what can these mothers do to alleviate themselves from it?
Right. So answer to this question is breastfeeding never hurts.
Okay.
Right. And it should be smooth. So if it is hurting, the latch is not proper.
Got that.
So the latch is the way the baby holds the breast.
Yes.
Right. That is called as latch.
Yes.
It is not proper. So you need to get it assessed. Right. Sometimes the mother is not able to position the baby properly. So that's why the latch is also not proper. Right. So there are two factors. Once the baby is able, mother is able to hold the baby properly, but the latch is not proper.
Sure.
Right. So the latch is not proper due to position, and there are a condition called as tongue tie or lip tie.
All right. Tongue tie or lip tie?
So tongue tie is the tongue is tied, or lip tie is the lip is tied.
Got that.
So it means the lip is not free, the tongue is not free.
Sure.
Right. So they need to get it assessed by a pedodontist.
Okay.
Or some lactation professionals, they also qualify with that also. So they can assess, but they have to get the procedure done by the pedodontist.
Got that.
Okay. So breastfeeding never hurts.
Sure.
Right.
Sure.
Definitely there will be a little sensation, which is normal,
Yes.
which happens. Yes, something is happening on to the breast. Mother will feel a little sensation, but
Right.
it never hurts. The ouchy feeling should not be there. Like,
Okay.
oh my God. And the mother should not dread, okay, no, I don't want to feed. So
Yeah.
if it is there, something is wrong. Something is wrong here.
Sure,
Right?
sure.
Either the latch,
Got that.
the position,
Yes.
tongue tie, lip tie, something is there. Baby is opening shallow mouth,
All right.
small mouth. Because sometimes what happens, the mother is just putting the breast into the mouth of the baby. The baby should be brought to the breast. That should be there.
Yeah.
Right. So you have to take the baby to the breast.
And they should be
right?
naturally suckling.
Exactly. It should be like this. It should not be like you are pushing the breast into
Got
the baby's
that.
mouth.
Got that.
Right. And that is how you go.
So, what percentage of the babies usually, what you have seen in your career, would be lip tight or tongue tight?
So if you see, I'm a mother of two.
Yeah.
Both the babies, they have had tongue tie and lip
All
tie.
right. All right.
So it is like that.
Sure.
See, I have seen so many things. I never anticipated that they will have it.
Okay.
Right. And they had it.
Sure.
Right. So it is not like 50 or 60%. It depends on. It comes on. The cases comes on and you see. So to be precise, if I say in my experience,
Sure.
I have seen approximately 70 to 80% normal.
All right.
Normal
20%.
and 20% having the tongue tie
that.
or lip tie. Yeah.
And the solution is pretty easy by a periodontist.
Yeah. Sometimes they would not need the incision or something, any procedure. Sometimes
Okay.
the massage with the periodontist, tell them they can do that
Sure.
to relax the muscles
Got
and
that.
to relax the lip
Yes.
and the tongue so that it comes up.
Got that. So breastfeeding hurting is not an issue.
No.
It's
not correct.
It's not correct.
Yes.
Yeah.
If a mother says breastfeeding hurts, it should not hurt.
Sure.
Right? They should not take it as normal or natural.
Got that.
Because somebody will say, "Arey hota hai ye to." It doesn't happen that way.
Sure.
Okay?
Useful.
Yeah.
And mothers also ask this question a lot, that what should I do if I feel that my milk supply is low? First of all, what could be the possible reasons for that, and what could a mother do to improve the supply of milk in the breast?
Right. So Mother Nature is very kind to us as a mother, So it's never like that we are not able to produce enough for the baby. We are able to produce.
Sure.
A mother can produce enough for her baby.
Sure.
The only thing is we lack the early initiation of milk, right? As soon as the baby is born,
Yeah.
the baby should be latched on.
Got that.
But when you see the institutional deliveries, mother and baby are not together. In C-sec and all that.
Yes.
Mother is in the recovery, baby is in the NICU or nursery, and
that's
the
right.
first feed which goes to the baby is the formula. Many a times. Okay. That hinders.
Okay.
Right? So how we can prevent that is, as soon as mother can ask the doctor who is delivering the baby to do the breast crawl,
Okay.
right? Or just put the baby onto the chest and let the baby do what the baby wants to.
Sure.
And then the baby can be handed over to the nurse and she takes the baby to the NICU
again.
or nursery, depending upon how the baby is. If the baby is, doesn't have any condition or anything, baby is having Apgar score, right Apgar score, and that can be done, right? And yes, that's a question when the mother comes in, am I able to produce enough? You can produce enough, right? But if you still have doubt, you have the lactation consultants, you can go and talk to them.
But what are the usual possible reasons of having a low milk supply?
So a low milk supply, as I said earlier also, if the initiation is not done.
Yeah.
Early initiation is important.
Right.
The body should know the baby is out now, I have to start producing. That's
right.
Yeah. And if the milk supply is definitely low, then the doctors are there. We are there to help them.
Got that. And it's
But
a function
don't
of-
anticipate in your own head, milk supply come hai. And of course, when, come to a baby born, baby is born to a mother. First, initially, you'll have the colostrum. So the amount of the quantity of colostrum is not very huge, not very high. It's just few mLs.
All right.
Right, it's just few drops. Initially you'll have few drops and then it gradually increases.
Sure.
And then the mother and the people around, they think that the mother is not having enough of milk. Because the people around, they forget the initial phase.
Yeah.
They only remember, if they were mother, they only remember when, milk starts to flow. कि इतना drip होता था. It used to start dripping from the other side when I'm feeding my baby from one side.
Yeah.
And that gives the doubt to the mother. That creates a doubt in the mother's head. It's not happening to me.
Yeah.
I'm not getting engorged breast.
Got that.
I'm not getting full breast.
Yeah.
So that creates a problem. The wire goes here and there.
Yeah.
Right? The wire is like, get the baby, you feed the baby. The more you feed the baby, the more the supply is.
Sure.
So it's like demand and supply.
Got
The
that.
more the baby feeds, the more is the supply.
Yeah. And is it also a function of nutrition for a mother?
Means the way she eats or
The way
something?
she eats, the elements that she takes during her own feeding.
Yeah. So definitely, you have to have good, well-balanced diet for your own body.
Yes.
Because the body of a mother will definitely give whatever the body has to the baby.
Yeah.
You look for the laborers. What is the quality of food they have? Still they are breastfeeding. They have the only choice to breastfeed.
Yes, that's right.
Right? They have the only choice. See the other mammals. Cows, buffaloes, donkeys. They don't go to any other mother to ask them to feed their own.
Sure.
Right? They
Yes.
don't borrow the milk from anybody.
Got that.
It's we human, we do that. But if we don't do that, and if we stick on to this thing, we'll definitely going to achieve that.
Sure.
Right?
For the new mothers also, especially mothers, yeah, a lot of lifestyle changes need to be made in terms of what their nutrition is, what they're consuming. So a few of them also asked the question, should I be consuming spicy food? Should I be consuming coffee while I'm lactating? What's your view on that?
Okay, so we talk about coffee first.
Yeah, absolutely.
Yeah. So coffee or caffeine.
Yeah.
That's the best thing. So if you see a mother when they are lactating, we say to keep a tap on it. It's not like if you're taking 3-4 cups of coffee or tea,
Yeah.
it's fine. No, keep a tap on it because you are ultimately transferring the caffeine. Caffeine is what it does. It wakes you up.
Sure.
Right? It gives you energy. Right? So if you are having caffeine at the same time when you are breastfeeding more, what will happen? You are transferring that caffeine into the baby.
Yeah.
The baby will not be able to sleep longer. Right?
Right.
So 1 cup of coffee, that's what usually happens. 1 cup of coffee or OR,
Yeah.
English or, not
Yeah.
Hindi or.
Yeah.
So it's English or 2 cups of tea.
Got that.
And the coffee should be latte. That's better.
Got that. With more quantity of milk.
Milk, yeah. So not a strong, espresso shot,
Sure.
right?
Sure.
That is how. Then comes to spicy food. If you are in use of spices in your food and taking it normally during your pregnancy and all that, you can take it. It's nothing like that. The only thing is when you're not moving much during your breastfeeding time, because you're sitting and feeding the baby, you're not
Yeah.
moving much.
Right.
Sometimes heartburn and acidity happens.
Yeah,
So
right.
that's why we say keep low on your spices. We don't say don't cut off.
Got that. Got
Go on, bland diet. No,
Sure.
we don't say that.
Sure.
No, but in Indian settings, we have seen that most of the mothers, they are given, bland diet, which is not correct. It doesn't make them happy.
Yeah.
And breastfeeding hormone is a happy hormone.
Got it.
If you are happy, because food with Indians and everybody, food makes you happy,
Yeah.
right? If you see food is not good, you go down.
Yeah.
Okay.
Right.
So what makes you happy, you should eat. Right? And yes, of course, a well-balanced diet is important.
Yes.
Right? So it is like what is made at home, you can eat whatever is made at home. If you make Chinese at home, you can have Chinese at home. because you're not mixing MSG or any other, bad sauces and, masalas in it.
Sure.
So you can have it. If you make Thai at home, you can have it.
Good.
Right? Spices, that is there. You can have it. No problem.
So in your natural day-to-day routine, whatever you are consuming, keep consuming, but have it in moderation. Everything is in moderation, because what you are having is getting transferred to the baby as well in the form.
But it's not like that. If a mother had a chili, she's going to give chili in her breast milk. So baby will no, not like that.
Right.
Okay. So it's like, yes, you are giving them the taste and texture of the food what you are having. So if you don't want your baby to be a fussy eater later on,
right.
So you should eat whatever you want him or her to eat later.
Okay.
Right now, because you are giving that taste and texture to that baby.
Sure. So a lot of children who move into the age of 3, 4, 5, 6, and we see a lot of eating patterns, like they don't eat a specific set of items, be it vegetables, be it pulses. So is it because of the initial time that during the breastfeed time the mother didn't give them a variety and a texture of food that they were supposed to be given?
Yes. So during breastfeeding, the mother didn't, eat. And when the baby is having the weaning, when you do weaning, when you start with the solid.
Yes.
So mother, she herself didn't like it. And she didn't introduce those things to the baby during the weaning.
All right.
Also.
Sure.
Right? So that is there. These two things combined together. Now, if the baby didn't have the taste during the breastfeeding, neither during the weaning. So later they will not want to eat that.
Sure.
Because they never had that taste and texture.
This makes sense.
Yes, of course. Everything is common sense when you think about breastfeeding.
Yeah.
But right now, lot of people, as soon as, a baby is born, right, in the family, everybody around a new mom, they become the book of knowledge around breastfeeding.
That's right.
Everybody will come, "Are ye karo." Everybody will say, "No, do this. I did that." No, every individual, every breastfeeding, every pregnancy is different.
Yeah. Right.
So cater them according to that.
Sure.
Right? You had gala breastfeeding.
Yeah.
It doesn't mean that everybody is going to have gala breastfeeding.
Yeah.
Look at me. My two babies, they had, tongue tie and lip tie. With my daughter, it was so difficult because she was premature. And until unless she didn't reach her, term, we didn't have the procedure done. It was like 1 month full of pumping and breastfeeding, so painful. It was difficult. But with my son, he was born at term, so we could have the procedure done as soon as he was born. So that made a difference.
Sure.
So it is like that. And nobody thought, even I never thought that I'm going to have a difficult breastfeeding.
Absolutely, yeah. Yeah.
So it's very, different and unpredictable.
That's right.
Right? So don't feed on saying, good things. Bad things also happen, but rectification can be done.
Yeah.
Right knowledge can be given.
Yes.
Right? So that is there.
And you raised a very relevant point that at that point of time when a newborn comes home, there are a plethora of places to get advice from, be it social media, be it from grandparents. And this is precisely the reason why we started out with this education series, that we'll have a doctor-backed session for you, where everything is science-backed, will be very, very logical. You don't need to go to 1,000 other places to find the right kind of advice. This is your one-stop solution. So yeah, good point.
Yeah, in fact, my nanny would say, "Arey Didi, aise karo. Arey Didi, waise karo." I was like, okay, I know. You you hold your horses there. It's okay. But everybody, they give their own advice.
That's it.
And mother being a new, sponge. Because if you don't know anything, you're like a sponge. Everything you'll, take in.
Yes.
And then when you impart it, when you, do it, you get confused.
That's right.
What is right, what is wrong? You don't know now.
And that's the primary reason for them getting overwhelmed, very anxious.
Leaving the breastfeeding in initial days.
Yes.
Giving it up. No, it's not happening.
True.
So that is there.
True. Victoria, while we were discussing all of that, the owner of the podcast also came up to me and said that my baby hasn't pooped for 2 days now.
Okay.
The baby is 15 days old, and the mother is, the family is pressurizing them to have some guttis and all to them.
Okay.
What's your view on that?
So, see, if the baby has not pooped, it's okay. It's okay. It's completely okay. So, if the baby is on mother's milk, they'll not poop for 7 days.
Okay.
Continuously.
Sure.
You can say. But wet diaper should be there. That's the only thing.
Right.
So, if the baby has not pooped for 7 days, the mother should not think the baby is constipated. Because breast milk is so light that it gets absorbed by the body. It hardly leaves any residue to come out. Residue is that poop, right, to come out. But when the baby is on a formula, the residue is much and they poop.
Sure.
Right? And sometimes it can be vice versa also. So my baby is pooping approximately 7 to 8 times a day.
Oh, yeah.
And the mother will think now the baby has got diarrhea.
Yeah.
No. So that's not also correct.
Okay.
So you can anticipate no poop for 7 days and max to max 10 to 12 poops in a day.
In a day. Got it.
Right? So don't think wo diarrhea hai and that is constipation.
Sure.
No.
And both of these things can happen from breast milk.
Yes, of course, from breast milk can happen. Right?
Got that.
But if it is continuing for longer, then of course you need the baby to be taken to the doctor and get it checked.
Yeah. Right.
Yeah.
Because we have a human tendency that we try to apply our own knowledge to what the baby also feels, and after a day of baby not pooping, maybe we get anxious. We think that's constipation, and that's what makes us anxious. So hence I asked this question.
Exactly. See, the only simple thing is keep it as natural as you can. Because breastfeeding is natural.
Right.
Natural नहीं होता तो mother के पास breast नहीं होता. You naturally has got the breast.
Sure.
It's not implanted from somewhere else and you got it. No. So keep it as natural. Don't get into guttis or gripe waters and all that. Traditional people, they would say no, give gutti. Potty nahi hua hai, give her gutti. Give him gutti.
Yeah.
Gripe water shuru kar do. No, they don't need. Just think logical. Other mammals, they don't do that.
Right.
Why only human mammal they have to do that? Why only humans? Right?
Right.
Yeah.
Right.
So breast milk is natural. Just keep it natural.
Sure. So overthinking is not the way here. Just think natural.
Yes. Just think logically.
Yeah.
That's it.
True. So we just discussed about if a mother can have coffee, can have spicy food, and does that affect the way the breast milk is sucked by the baby or not? Does a mom's diet have anything to do with digestion issues, gas issues in the baby? Does that happen or not?
It's a complete myth. Right? If the mother will eat this, then the baby will become gassy.
Okay.
Right? But it doesn't happen that way. So what happens? Mother is deprived of everything. She's not eating. Means if she's a non-vegetarian, she is not eating chicken because chicken makes gas. If she's a vegetarian, she is deprived of chana, rajma, everything, bhindi and all that. Nothing is given because that creates gas, and baby will also have gas. No, it's not like that. It's a total myth. Gas and flatulence is not produced by what mother is eating. It is produced by the milk which the baby is drinking.
Sure.
Right? So it's not related to, because baby will have milk in any form. Either it's a formula or it's mother milk.
Yes.
Just think logically, if the baby is having only formula, from where the gas is coming now? Mother's milk to nahi hai.
Right.
From where the gas is coming? Think. Right. It's through the milk, the lactulose, the bacteria, which is, having a fight or whatever in the tummy, that is producing the flatulence as an end product. So don't associate mother's food with baby having gas or colic.
Sure.
Okay, so she is allowed to eat everything what is made at home. If you are eating chicken,
Yeah.
your wife can eat chicken if you have a small baby.
Right.
If you are having rajma, chanas, bhindi, anything at home,
Right.
she's allowed to eat.
Got that. Got
Right?
that.
And one thing is there, very commonly seen, the new mother is asked to drink more milk. Because they think milk will
produce
help
milk.
in producing milk,
Yeah.
which is not correct.
That's right.
Then see the cattle from which we get the milk. So supposedly we have taken out 10 liters of milk from a cow or a buffalo. We can give that milk to the cow and buffalo to drink, and then we'll take out 20 liters. Can't be done that
Sure.
way. Okay, so it's not like milk will help to produce milk. No, it's also one myth. Milk, you can drink as much as you want. If you don't want to drink, don't drink.
Sure.
Right?
Yes.
So that is there. Because I took up this thing because we were talking about milk. You know, that's a common thing I have seen.
Yes.
Drink milk, drink milk. I'm taking 3, 4 glasses of milk.
Right.
Still my, milk supply is low.
Right.
Milk supply is low because you're not latching the baby.
Yeah.
The baby is not creating that demand. How will the body supply? Because the demand is not created. You take n number of galactogogues. Galactogogues are things which helps in producing milk, right? Natural galactogogues, you take it, but you're not latching the baby.
Yeah.
You're waiting for the breast to become full. Breast will become full when it is giving an indication it's been long that you have not fed the baby.
Sure.
It's an indication. Okay, now you go feed the baby. But if you keep on doing it, the supply is created, the demand is created,
yeah.
the supply will happen.
Got that.
So nothing can make the baby gassy or colicky.
Sure.
Whatever the mother wants to eat,
Sure.
she can eat.
Right. And consuming milk will not produce more milk.
No, definitely not.
Right.
Right?
So my next question spans from the fact that a lot of mothers say that the topic that we discussed also, that the breast is full, I have a lot of milk but my baby is not taking enough. Is there any way to store the breast milk properly, safely, to be consumed by the baby later?
Yes. So we can pump.
Yeah.
So we have got variety of breast pumps in the market, wearables or electric, manual. It completely depends on how much mother wants to pump.
Yeah.
Choosing the breast pump, right? So she can get a breast pump and pump the milk, and that milk can be stored in the fridge, right? But it should be stored on the shelf, not in the door.
Okay. Why is
Because
that?
when you open the fridge, the first place to lose its cool is the door,
Got that.
right? And the shelf loses the cool later.
Okay.
Right, so it should always be stored on the shelf, not in the door.
Not in the door.
Yeah.
Got that.
But if you think that you're not going to use it within 48 to 72 hours max to max, then you can freeze the milk.
All right.
You can definitely freeze the milk for 6 to 8 months.
Oh.
And sometimes in good conditions of weather, and you have got only freezer for milk storage,
Yeah.
not for like in Indian settings we have fridge as a cupboard. We keep everything, or cosmetics, foods, everything goes
Yeah,
in the fridge.
right.
So if you have a dedicated freezer, you can store up to 12 months also. Depending upon how much you are able to maintain the temperature.
Got that.
Right? But definitely 6 to 8 months you can definitely store it in
Sure.
the freezer.
Sure.
Yes, and in the normal fridge, max to max 48 to 72 hours, max to max.
Got that.
Right, and then you have to, and it should always be followed as FIFO, first in, first out.
Yeah.
So you have to label, you have to put the date and time.
Yeah.
Then you can, whenever you are using it for the baby, the FIFO can be applied.
Got that.
So which goes in, comes out first,
Yes.
and that can be given to the baby,
Right.
thawed and given to the baby.
Got that. And is there any best practice on the frequency of usage of the breast pump? For how long should you be using that? Is there any best practice on that?
It entirely depends on mother. what is her goal. No. So sometimes mothers, they just want to pump only to make their breast soft so that the baby latches on.
Got that.
Sometimes the mother wants to pump so that she can store it and she can move out.
Okay.
Sometimes mothers, they are pumping at work when they get back to work.
Sure.
So it is entirely the mother's goal what she wants to do. And what is the need of that time.
Got that.
Right?
And to prevent the formula feed also, you pump the breast milk and later you can consume.
Of course, yes, you can do that.
Sure.
Thank you so much. It was a lovely session today, and I thank Tebined for having me here. I hope this will give you more knowledge and understanding and more insight related to what all doubts you had related to breastfeeding, and in future we will definitely have more sessions related to this. Thank you.
Thank you for joining us on this honest discussion on this intimate but highly misunderstood topic on feeding the baby. There is no right way to do it. It's your way, followed with the right guidance and the right approach. So follow us for more resources, for more advice, for more educational content on these topics. Thanks a lot.